Where would we be without these cute little creatures? Well, in pharmaceutical research, not very far, because we really do have to rely on them to test efficacy and safety of new drugs. For example, injecting them with some beta amyloid. Well, what is beta amyloid? Alzheimer's disease, one of the most daunting diseases out there, and it occurs when there are deposits of a protein called beta amyloid that build up in between nerve cells and essentially clog up the machinery. Well, one way to try to attack these is what we call monoclonal antibodies. These are drugs, and they are specifically designed to attack these beta amyloid deposits and break them apart. And this is where these little guys come in. They're injected with the beta amyloid. Their body reacts to that by producing B cells, which are part of the immune system, and those in turn produce antibodies that eventually can be removed and isolated from the spleen of these animals and made into a drug that can then be infused into people with Alzheimer's disease to break apart those beta amyloid deposits. Sounds very good. Unfortunately, it doesn't work quite as well as we would have thought it would. There is a slowing down of the regression or the progression of Alzheimer's disease with a little bit improvement in memory, but at a cost. Two kinds of cost: side effects, which can be seizures or bleeding in the brain, and financial. Costs about $30,000 a year to treat someone with these monoclonal antibodies for Alzheimer's disease. So one has to think about whether or not this is the best way to apply the difficult to get funding for pharmaceuticals. But there may be another approach. Interestingly enough, one promoted by Dr. Dean Ornish, who first rose to fame when he treated heart disease patients with vegetarian diets and exercise and showed that the treatment was as effective as using certain medications. Well, now he has launched into treating Alzheimer's disease in a similar fashion. In a very interesting double-blind randomized study, some subjects were given meals, vegetarian meals provided by the study that they would eat. They were given vitamin and mineral supplements, generally larger doses than what one would normally take. They were also taught exercise methods and meditation and yoga. And it turned out, after about 18 months of monitoring, that the patients who were on this regimen did better than the control group. And in fact, the improvement was very similar to what is being seen with the monoclonal antibodies. Well, the diet was a vegetarian diet, which included lots of fruits and vegetables, and especially berries, because berries contain these compounds called polyphenols, which are beneficial for all kinds of reasons. Now we're finding out that they may be important in trying to ward off Alzheimer's as well. Isn't it amazing how often these videos end up with me eating berries? But that's because that is where the evidence takes us.